Good afternoon, everyone, and welcome to today's webinar on a framework for a public health approach to substance use. My name is Ian Colbert. I am the Executive Director of the Canadian Public Health Association, and I'd like to wish you a happy Canadian Public Health Week that we're celebrating this week. And I'll start by acknowledging that while we're all coming together from different parts of Turtle Island on this virtual platform, CPHA's offices are located in Eastern Ontario on the ancestral unceded territory of the Algonquin and Anishinaabe. So I am very pleased to be joined today by two project officers at CPHA who were directly involved in the development of this framework. And with no further ado, I'm going to turn it over to Kelsey McIntosh and Alexi Kim. Kelsey, the floor is yours.
Thank you so much, Ian, and thank you everyone for joining us today. My name is Kelsey McIntosh. I use she and her pronouns, and I'm a senior project officer on CPHA's Normalizing Conversations project. I'll pass it over to Alexi to get us started.
For joining us today. My name is Alexi Kim. I use she, her, elle pronouns, and I'm also a project officer on CPHA's substance use project. So on behalf of Kelsey and I, we'd also like to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe, who have been the guardians of this land for millennia, and we're grateful for their stewardship and acknowledge the great privilege we possess to be able to live, work, and learn on these lands. We recognize that working towards reconciliation goes far beyond this acknowledgement, and CPHA is making strides to embed truth and reconciliation in its work, but this is ongoing. We encourage learning at all levels and would urge you to learn more about the land you reside on and embrace opportunities to learn from Indigenous peoples and communities across Turtle Island. I myself work for CPHA, but I'm joining from Tiohtià:ke, also known as Montreal, which is the traditional territory of the Kanien'kehá:ka and has long been a site for meeting and exchange among many First Nations. I recognize that I'm a guest on these lands and that the struggle for Indigenous rights is deeply connected to the work that we do. And as we move today into our conversation on a public health approach to substance use, I think it's imperative that we acknowledge the disproportionate impact and harms of substance use stigma and criminalization on Indigenous people. And this emphasizes the need for culturally safe, decolonized, and anti-racist approaches to substance use, which we'll get into in more detail later in the presentation. Kelsey and I would also like to acknowledge the trail of loss and heartbreak left in the wake of our country's ongoing drug poisoning crisis and public health emergency. We can't be here today talking about a public health approach to substance use without first reminding everyone that since 2016, Canada has lost more than 42,000 people to opioid toxicity deaths alone, and data from earlier this year shows an average of 22 deaths per day. So as we talk through the principles of a public health approach for the next 45 minutes to an hour or so, we'd invite you to take a moment to remember those who we've lost and the ones who grieve them. And we'd like to recognize the individuals represented in this data, as well as those who aren't represented, but who continue to experience harms from our toxic drug supply and drug policy. And our thoughts are with these individuals and their communities, and they remind us every day that the work we do matters and that these conversations need to go beyond these online spaces. So with that, the brief agenda for today will be to summarize some of the background on CPHA's work in substance use, the rationale for developing a framework for a public health approach to substance use. We're going to go over the scope of our framework and some of the supporting research and evidence that helped us arrive at our definition. Kelsey and I are then going to go over the principles of the approach and conclude by providing some tools and resources to support your work. So to start, we actually have to go back in time briefly and provide a little bit of context on some of the work carried out by CPHA in recent years. So prior to 2014 and going back as far as the early 90s, CPHA's membership had passed several resolutions related to illegal psychoactive substances and the need to develop strategies that were based on a public health approach. And this includes several published position statements on tobacco and alcohol, the recognition of harm reduction as an integral piece of health promotion and protection, and calls for national frameworks on substance use to be based on a public health approach. CPHA has endorsed various lower risk use guidelines and even appeared before the Supreme Court of Canada with many other interveners on behalf of Insight, which was the first legal supervised drug injection site in North America. CPHA is also the signatory of the Vienna Declaration, which in 2011, which calls for the reorienting of drug policies towards evidence-based approaches that respect, protect, and fulfill human rights, which we'll get into, and implementing and evaluating evidence-based prevention, regulatory, treatment, and harm reduction interventions. And all this work leads us to 2014, when CPHA publishes a discussion paper titled A New Approach to Managing Illegal Psychoactive Substances in Canada. And by new approach, what we really meant here was a shift away from prohibition and criminalization to a public health approach. So this paper describes the policy, the legal, public health, health delivery research and surveillance aspects that would support this new approach, and articulated a vision for 2025 with some specific calls to actions for the public health community, private and non-government sectors, the Government of Canada, and provincial and territorial governments. From 2016 to 2018, and with the imminent legalization of cannabis, CPHA led a SUAP-funded project on a public health approach to cannabis and other substances. And this involved community engagement across all provinces and territories to understand provider and community perspectives on a public health approach to cannabis, and to help develop tools and resources in areas of prevention, health promotion, and harm reduction related to cannabis. In 2017, CPHA then released a public health, a conceptual framework, where it defined public health practice as an approach to maintaining and improving the health of populations that is based on the principles of social justice, attention to human rights and equity, evidence-informed policy and practice, and addressing the underlying determinants of health. And we'll see later in this presentation how elements of this definition were integrated into a public health approach of substance use that we recently released. So that brings us to 2020, when CPHA was once again funded through Health Canada's Substance Use and Addictions program for the project Normalizing Conversations, Engaging Public Health, Public Safety, and Communities to Build Capacity for a Public Health Approach to Substance Use, big title. So the primary objective of this project is to build the knowledge and capacity of communities to implement a public health approach to substance use. And to do so, a big part of that project involved creating an online hub of resources in both official languages, which we call the Canadian Substance Use Resource and Knowledge Exchange Centre, also known as SURE. Because we recognize that there are plenty of organizations across the country that are doing incredible work in the space of public health and substance use, and wanted to ensure that all these resources were well socialized and accessible to providers and practitioners. So our project tools and resources, as well as the resources from over 200 organizations across the country, can be found there at substanceuse.ca. And Kelsey would go into a little bit more detail about these activities, but I did want to provide an overview of what went into the development of our framework. So with the goal of implementing a public health approach at the start of the project, we knew we needed to have at least a working definition of a public health approach to substance use. And with that, we began a literature scan at the start of the project in 2020. In parallel to that work, and for the most part of 2021, keeping in mind the timing of the pandemic and some of the barriers that can arise for community engagement, we proceeded with running key informant interviews, focus groups, and a survey of professionals, followed by some knowledge exchange forums, and the start of the development of certain tools and resources in 2022. And last year, 2023, was dedicated to rounding out and piloting some of these tools and working on dissemination with the help of our community partners. And then finally, in January of this year, 2024, we released the framework. So with that, I will pass it along to Kelsey, who will expand on some of these activities.
Thanks so much, Alexi. So today we'll be talking about CPHA's recently released framework for a public health approach to substance use. But before we get into the details of this policy statement, it's important to first understand why this framework was needed. So in order to build professional and community capacity for implementing a public health approach, we first needed to have a clear definition of what was meant by this. So there's been a documented lack of consensus within literature, different groups of professionals, and across sectors. And most attempts that have been made to define a public health approach have not adequately included people who use drugs. So on this slide, we can see a few examples of different publications and headlines that discuss a public health approach, further emphasizing that there's a real need to have a clear shared understanding of what is meant by this term. One notable paper is a qualitative systematic review and thematic analysis on a public health approach to substance use, which was published by CPHA and colleagues in 2023, which noted that while there's no current consensus on a definition, there is substantial agreement when it comes to public health approaches to specific substances. So the framework we'll be presenting today aims to add to this body of work and move us closer to creating consensus on what we mean by a public health approach. So in the beginning stages of the Normalizing Conversations project that Alexi introduced, a rapid scan of literature was done to better understand the existing work that's been done to define a public health approach. And this really helped to inform the preliminary definition that was used in the initiation of this project during our project activities and discussions. And this was included in our knowledge exchange forums and survey of professionals, which we'll be discussing in a bit more detail shortly. So to provide additional evidence and further define this approach, CPHA initiated a systematic scoping review at the University of Alberta to describe how a public health approach to substance use has been previously defined and to identify some of the key values and concepts that are related to it. So the methodology for this review was published in 2022, and the final review included 231 peer-reviewed articles and grade literature sources. Analysis of these sources found that the key values that inform a public health approach include things like health equity, cultural safety, human rights, anti-racism, and decolonization. The literature discussed social determinants of health extensively, noting a need to act on these determinants across the life course and to prioritize the improvement of social and environmental conditions in prevention efforts. Further, it noted that person-centered care and trauma-informed approaches to care should be fundamental to the design of supports and services, and that approaches should recognize that substance use occurs on a spectrum with both potential benefits and risks. So these are all some principles that we'll be touching on later in our presentation, but overall the goals of such public health approaches should include harm reduction, maximizing benefits, prevention, and improving individual and community health and well-being. So the initial analysis of these sources has really helped to further refine our framework and provided evidence to support many of the principles that had been identified in our initial scan and community engagement activities. So as Alexi mentioned, another big area of the project was community engagement. So this project involved work closely with 3 community partners at the Manitoba Harm Reduction Network, Mainline Needle Exchange, and Thunder Bay Drug Strategy. So in the initial stages of the project, key informant interviews were done with people with lived and living experience of substance use, public health, health and social service providers, and public safety professionals to better understand the current drug landscape, what supports are needed for people who use drugs, and what steps are required to implement a public health approach. Next, we conducted focus groups with people with lived experience and our community partners to learn more about their perspectives on what areas professionals need more knowledge on in order to deliver safe and effective services to people who use drugs. We also asked about the ways in which those professionals can effectively implement a public health approach from the perspective of our community partners. Participants also discussed the barriers that they experienced when accessing substance use health services, and all of the findings from these engagement activities are summarized in our key informant interview report and focus group report, which can be found on cpha.ca. These activities all help to inform the project's initial definition of a public health approach, which was presented to community partners and those that access their services during our knowledge exchange forums. And participants in each of these activities were compensated with honoraria for sharing their time and their expertise with us. So during those forums, participants were presented with an earlier, more simplified version of the public health approach definition, and we engaged in discussions on what principles should be included in these approaches or any changes that should be made to that definition. So it was highlighted in those discussions that the public health approach definition should be one that is applicable to different contexts and is broad enough to allow for flexibility. So we've included some of the feedback that we received on the slide here from our community members when discussing this definition. This included emphasizing that collaboration with people with lived and living experience of substance use needs to be of the utmost priority in this definition, that we need to explicitly name systems of oppression and the historical harms of drug policy. We need to recognize the benefits and the risks of substance use and clearly identify what's meant by determinants of health by including examples like housing and healthcare access. In addition to these activities, in 2021, CPHA conducted a national survey of public health, public safety, and health and social service professionals on a public health approach. So the goals of this survey were to better understand beliefs, knowledge, capacity, and access to information related to a public health approach. And the findings from this survey were published in a final report that was authored by Dr. Tara Marie Watson out of the University of Toronto, who led the survey development and analysis, along with 2 summary snapshots that are available in English and French, and all of those resources can be found on substanceuse.ca. So this survey collected responses from over 1,000 professionals and presented a simplified version of the public health approach definition. It was defined as being a non-judgmental approach that seeks to maintain and improve the health of populations based on principles of social justice, attention to human rights and equity, evidence-informed policy and practice, and addressing the underlying determinants of health. So based on this definition, 76% of respondents stated that they were aware of a public health approach, and 54% indicated that they had a high degree of comfort with applying it. Within this survey, respondents were specifically asked about changes that they feel should be made to this definition, similar to what was done in our knowledge exchange forums. And the key points that were emphasized here were, again, to explicitly recognize the importance of collaborating with people with lived and living experience of substance use, to include trauma-informed lenses, highlighting the need for community-led action, and also being critical of the terminology that was used when defining this approach. So these suggestions have all helped to inform the framework that we'll be presenting on and are further explored in a paper that's led by Dr. Watson, which will be published in the International Journal of Drug Policy. So each of these pieces of research and engagement have greatly informed our overall project and have led us to our current understanding of a public health approach.
Thank you, Kelsey. So as I'm sure everyone can imagine, our current understanding of a public health approach has evolved significantly since in the last 4 years and even beyond that since 2014, and it will certainly continue to evolve. However, with that, we're really happy and incredibly proud of CPHA's policy statement on a framework for a public health approach to substance use, which has integrated the various pieces of work Kelsey outlined to provide an overview of what CPHA endorses as a public health approach to substance use. And by substance use here, we do include the full range of legal and currently illegal psychoactive substances. And we did not separate the framework based on substance. And so this framework does describe the approach that CPHA will be using in the development of policy, advocacy, and program work. And it can be found in English and in French at cpha.ca on the homepage or under advocacy position statements. So although we do encourage others to consult and certainly integrate principles into their work or context, it's important to also keep in mind the scope of this framework. First and foremost, it describes the perspective that CPHA, in collaboration with communities and stakeholders, has established as being foundational to future work and shouldn't be acting as an evaluation tool or offering specific guidance on implementation. And this scope was in part informed by our community partners who asked that the framework remain accessible and a high-level document. They wanted it to be written as a commitment to communities and people who use drugs, rather than CPHA's guidance to researchers, planners, or decision makers. However, this high-level framing does give us the opportunity in the future to build upon these principles, working with experts in the field to develop more implementation tools in the future. So we know that this definition will continue to evolve based on input from people with lived and living experience of substance use, public health, health and social service providers as well. So the framework encompasses 10 key principles, which are presented in no specific hierarchy or no order of importance, as all of these principles are quite interconnected and build upon each other. And these principles were written with flexibility in mind, as they can be applied differently across communities and contexts. And Kelsey and I will go over these different principles and hopefully bring them to life a little bit for you. So the first principle of a public health approach is that it respects the autonomy and right to self-determination of people who use substances. And here, respecting autonomy does not equate to endorsing or promoting harmful behaviors, but instead fostering environments where individuals feel supported in taking control of their own health journeys. So every individual has the inherent right to make decisions regarding their health and their well-being, and this extends to choices surrounding substance use. So a public health approach to substance use should seek to empower individuals by respecting their autonomy and providing them with the tools and the information to make informed choices, and ensuring that their voices aren't only heard, but centered in decisions regarding their care. And this pillar specifically pertains to Indigenous peoples who've historically had these rights denied. We've also included a quote here from our survey of professionals, and this was shared by someone in the social services sector. So I worry about a public health approach shaming drug use, as it has cigarette smoking to push people towards abstinence. I think it is a human right to have bodily autonomy, and that includes having the freedom to decide what goes in your body. A public health approach also acknowledges that substance use exists on a spectrum with both harms and benefits, and focuses on reducing the potential harms and maximizing the potential benefits. So the first piece of that principle is that substance use, like most things in life, is not static. It occurs on a spectrum from no use, beneficial, lower risk, higher risk, and addiction or substance use disorder. And we've included an image from Health Canada of this spectrum, and you'll find different iterations in different organizations. But all that to say, a person might move across this spectrum over time or be at different stages for different substances. It's also worthy to note that what might be beneficial use for one person is higher risk use for another. So it is very dependent on your context, your age, and other factors. It's for this reason and this spectrum that CAPSA's concept of substance use health has been embraced by so many organizations, including CPHA, because substance use health stands alongside our physical and mental health, and we should be striving to create programs and policies that support people across this spectrum, and not only creating programs and policies for either end of the spectrum. This principle also requires that we understand why people use substances, which includes spiritual, cultural, medical, social, and pleasure purposes, and that there are real benefits that can be provided, including pain relief, coping with trauma, supporting substance use treatment, social connection, pleasure, and recreation. So without requiring a reduction in use, a public health approach aims to reduce the harms, including the harms created by stigma and discrimination and our drug policy, and increase benefits at each stage of this spectrum where possible. So just like there's a spectrum of substance use, there should also be a spectrum or a continuum of public health intervention policies and programs that are attentive to the benefits and the harms of substance use, as well as the unintended effects of policies and laws that are implemented to manage them.
So the next principle focuses on approaching substance use using a health and human rights framework rather than using a criminal justice framework. It also highlights that a public health approach is one that acknowledges the historic and the current harms of drug policy. So evidence has shown that criminalization of substance use disproportionately harms those who already experience broad systemic inequities, and that punitive measures do not achieve their intended outcomes of reducing drug use or reducing the risks associated with drug use. In fact, they often have the opposite impact and can worsen health outcomes. It's imperative that we use the evidence that's available to inform our public health policy and action. And this is the focus of a later principle that Alexi will elaborate on. which emphasizes that a public health approach is one that must be evidence-informed. So rather than using this punitive approach, a public health approach prioritizes equity and supports the health and human rights of people who use drugs. This lens challenges the current model that focuses on individual responsibility and criminalization and shifts us towards creating systems that acknowledge and respect human rights. On this slide, we've included another quote from our survey of professionals, and this was shared by someone working in the public safety sector. They shared, "In my experience, substance use is a public health issue. I'm in law enforcement and have repeatedly seen firsthand how potentially harmful a criminalization and enforcement approach is." So this quote highlights that there is agreement between individuals working in different sectors that a public health approach is needed, and collaboration will be required for that to be realized. This collaboration must, of course, extend to people with lived and living experience, which brings us to our next principle. A public health approach is one that recognizes and collaborates with people with lived and living experience of substance use. And this means acknowledging them as experts, fairly compensating them for their work, and giving appropriate job titles that they feel comfortable with and that reflect their expertise. Again, we acknowledge that the principles we're sharing today are quite broad, and they don't provide specific guidance for implementation. So these best practices should come from organizations of people with lived and living experience of substance use. And we've included two great resources here we'll share in the chat, the first being CAPS's Code of Conduct for engaging with people with lived and living experience. The second being the Hear Us, See Us, Respect Us report from the Canadian Association of People Who Use Drugs, known as CPHA, and the Canadian Drug Policy Coalition. These resources are both available on substanceuse.ca, and they both provide tangible recommendations and best practices that come from people who use drugs. Further, we'll highlight that a core value of health promotion is to utilize a participatory approach when engaging with populations in order to address needs. And this is really central to a public health approach. Efforts towards meaningful partnership promote equity and accessibility, build capacity to respond to community needs, and result in work that more effectively addresses the barriers that are experienced by people who use drugs. The next principle we'll go over highlights that a public health approach supports the underlying determinants of health and addresses health inequities. This includes addressing physical, biological, psychological, and social determinants of health, like education, housing, or social inclusion, as well as the drivers of health inequities. And this includes things like power imbalances, racism, classism, ageism, and sexism. By recognizing that substance use is influenced by these factors, this approach goes beyond solely focusing on individual behaviors and choices. It acknowledges that health outcomes are shaped by broader systemic and structural factors such as poverty, discrimination, and access to resources. We'll note that many of the services that are available to people who use drugs don't fully address these social determinants. And this is including all services, not just those that are solely focused on substance use health. And this again emphasizes that a public health approach will require collaboration across sectors to help reduce the siloing of health and social services in order to meaningfully address these determinants of health. By addressing the determinants, a public health approach aims to create supportive environments and to advocate for policies that reduce these inequities, provide equitable access to services, and promote harm reduction, prevention, and treatment options that are responsive to a diverse range of needs. Further, a public health approach is one that works to protect and promote the freedom, health, wellness, and safety of people who use substances. And we really want to highlight here that the term safety is not to be interpreted as protecting people from themselves. Each individual will define what safety looks like for them, and this is really dependent on their lived experience and context, and all of those social determinants that we just touched on. So a public health approach should seek to promote safe environments, keeping in mind that safety is subjective, but that no one should be victimized, traumatized, or experience discrimination for any reason, including for their substance use. So interventions that are using a public health approach should not only provide equitable access, but they must ensure that these services are free of judgment, stigma, fear of criminalization, or social isolation. This connects us back to that first principle that we discussed in this framework about respecting individual autonomy, and that every person has the inherent right to make decisions regarding their health, and this includes their choice to use drugs. A public health approach is one that must protect and promote that freedom, along with the health and the wellness of people who use drugs. By recognizing and addressing these broader societal factors, a public health approach can create a more just and inclusive society where the rights and the dignity of all individuals, regardless of their substance use, are protected and upheld. And that brings us into our next principle, which has been discussed a little bit already throughout some of the other pillars, but a public health approach must be collaborative and it must be comprehensive. So this means ensuring a continuum of programs and services are available to meet people where they're at. And that kind of brings us back to that spectrum that Alexi talked about. So in this context, when we say comprehensive, that refers to having a range of programs and services that include prevention, harm reduction, social support, and treatment that are available to people across that spectrum of substance use. And this also connects us back to CAPS's concept of substance use health, which aims to achieve equitable access to healthcare programs, services, and supports related to substance use by viewing our substance use health in the same way that we view physical or mental health. These services must be designed to meet individuals at their current state of readiness for change and to address their self-identified needs. This is one of the ways that this approach can center collaboration by being patient-centered and collaborative with people who use drugs. In addition, a public health approach should include collaboration across services and sectors, and that's something that we've touched on a little bit earlier. We've included, again, another quote from someone working in the justice system shared in our survey of professionals. And they shared, what I would like to see is working groups, collaboration and change to take place at a systemic level. What we're doing isn't working, and the constraints imposed upon us by funders, contracted mandates, and the constant hot potato attitude of government agencies makes it impossible to just simply help people. And this quote really embodies this principle and the ultimate goal of public health, to help people and to improve health outcomes.
Okay, so the next principle of a public health approach to substance use is that it has to be trauma and violence informed, gender transformative, anti-racist, anti-oppressive, and culturally safe. And it was particularly important for our community members that these systems of oppression or systems of power be explicitly named, because health and social structures, despite wanting to do good and having good intentions, do perpetuate oppression and racism and can contribute to substance use harms through stigma, criminalization, and limited healthcare access. So to improve health outcomes for all and to work towards health equity, a public health approach needs to understand, firstly, the relationship between trauma and substance use, ensuring that our systems, our policies, and our programs are trauma and violence informed, and try to prevent further traumatization or re-traumatization. A public health approach also needs to understand how power dynamics influence substance use initiation and cessation, as well as how gender roles and identities influence our response to interventions, the impacts of stigma, health-seeking behavior, and substance use-related harms. And lastly, understand the impacts of colonization, those power imbalances, and discrimination to be able to move forward with programs that do foster cultural safety and meaningfully partner with Indigenous communities, which does tie us back to our principle, our first principle on the autonomy and the right to self-determination. On this slide, we've also included another quote from our survey of professionals, and this was shared by someone working in the health sector. So TVIP, trauma and violence informed practice, allows a shift from a place of what is wrong with you to what happened to you. It allows the clinician to focus on the person and their needs, their traumas, their experience in their life, and not on a moral judgment and stigma. And you could see how that shift would probably improve health outcomes, and moral judgment and stigma is a great barrier to healthcare. And so this quote, of course, connects us to the next principle, which is to work to end stigma and discrimination. So on this point, a public health approach acknowledges the harmful impacts of stigma and discrimination while actively working to reduce them. So stigma and discrimination not only harm people who use drugs, but hinder effective prevention, treatment, and harm reduction efforts for everyone across the substance use spectrum. Our community partners through the community engagement, also identified stigma as a major barrier to services and to implementing a public health approach, both at the level of service provider knowledge and attitudes, as well as in stigmatizing policies and practices, which is illustrated through the lack of harm reduction service options or limited ability to access treatment. And this, of course, requires reflexivity because we know that many past public health interventions, or that previous quote about public health responses to smoking, have been stigmatizing or have shamed substance use, or only promoted one side of the spectrum through, for instance, abstinence. So we also recognize the challenge of addressing all forms of stigma, from individual to systemic, which is why this is a principle or a project has really dug into over the last 2 years. And Kelsey, in a few slides, will go over one of the tools that we've developed for this pillar specifically. And so this brings us to the last pillar of a public health approach, which is that it needs to be pragmatic and informed by evidence, or evidence informed. So this pillar points to the idea that while scientific evidence is fantastic, evidence alone without context, without contextual understanding, really does fall short in guiding decision-making. So a good way to visualize this is to imagine an intervention working well in a lab with well-controlled variables and conditions, which would then fall short in the real world because it's either not socially accepted or it becomes the target of political debate and thus is not successful in improving health outcomes. So pragmatism in public health wants to bridge that gap between scientific evidence and practical application. So one could say that an intervention is pragmatic when it prioritizes practical and measurable outcomes that can be achieved within our reality, within existing social, economic, and political realities. So a pragmatic approach recognizes that individuals and communities are complex and also face unique needs and challenges related to substance use, which connects back to a lot of the pillars that we've covered today, taking into account cultural, social, and economic factors. And this is a key concept that underpins harm reduction, which recognizes that eliminating all substance use is not realistic. It's not achievable, and in most cases, not necessary to improve health outcomes. So the pragmatic lens of harm reduction focuses on minimizing harms and maximizing potential benefits of substance use through interventions like needle exchange programs, naloxone distribution, or safer supply. And we know that social problems need multi-pronged approaches, which is why a one-size-fits-all approach won't work. And we need to be mindful of what works for who and look at the practical applications of our programs and policies. And then the second part of this principle speaks to a public health approach being informed by current relevant evidence that reflects the needs and voices of people who use substances. So unlike evidence-based decision-making, which relies primarily on scientific evidence, evidence-informed approaches go a little bit wider in the range of evidence sources, which will include things like research studies, local data, professional experience, lived and living experience, and stakeholder perspectives to hopefully inform decision-making and shape interventions and policies that reflect that pragmatic real-world application. So to recap, a public health approach is one that respects the autonomy and right to self-determination of people who use substances, acknowledges that substance use exists on a spectrum with both harms and benefits, and focuses on reducing potential harms and maximizing potential benefits. Approaches substance use through a health and human rights framework, not a criminal justice framework, while acknowledging the historic and current harms of drug policy. It recognizes and collaborates with people with lived and living experience of substance use as experts and fairly compensates them for their work, supports the underlying determinants of health and addresses health inequities. It works to protect and promote the freedom, health, wellness, and safety of people who use substances. It is collaborative and comprehensive and ensures a continuum of programs and services are available to meet people where they're at across that spectrum. It is trauma and violence informed, gender transformative, anti-racist, anti-oppressive, and culturally safe. It works to end stigma and discrimination, and it's pragmatic and evidence informed.
Thank you, Alexi. So now that we've gone deeper into each of those different principles and we've described the approach that will be used in the development of CPHA's policy, advocacy, and program work, we'd like to just share a few examples of how this framework might be applied. So since its publication in January, the framework has been positively received and supported by a number of our key partners within our project, provincial public health associations, community health centers, and the BC Office of the Provincial Health Officer. And a few specific ways that we've heard of the framework being applied so far include public health unit using this framework as a foundation when developing anti-stigma initiatives. There's also a local community health center incorporating this framework when developing their policies around serving individuals who use drugs. And finally, a research lab integrating several of the principles of this framework into a grant application on the impact of public health policy on access to opioid agonist therapies. So we hope over time to see continued uptake of this framework across different sectors and professions and welcome any feedback. And as we've noted, the framework in its current state doesn't offer guidance on implementation, but CPHA hopes to further build capacity for implementing this approach through future project work and the development of additional tools and resources. So we acknowledge, again, that this definition is iterative. It should continue to evolve and be refined based on lived and living experience, emerging evidence, and input from public health professionals and health and social service providers. Future work in this area should focus on supporting the implementation of a public health approach across different communities and contexts in different facets of public health. So to close off our presentation today, we wanted to share a few of the resources that have been developed through our project to help improve knowledge and capacity for implementing a public health approach. So the first is the Canadian Substance Use Resource and Knowledge Exchange Center that Alexi introduced earlier, known as SURE. And this is a database of resources, including toolkits, webinars, academic articles, reports, and many more from organizations across Canada. It covers a variety of different topics, sectors, and many of our resources are available in English and French. And these can all be found at substanceuse.ca. This includes all of the project resources that we'll mention, and we can put links to those in the chat as well. These resources include our final report that details the findings of our national survey, along with the 2 research snapshots that give a shorter summary of that report. We also have a handbook on a public health approach that was published last year with the Center of Excellence for Women's Health. And this outlines many of the principles that we've discussed today and provides a lot of helpful resources that build on many of those principles. And finally, we have our Challenging Structural Substance Use Stigma workshop package that was published last month in collaboration with CAPSA. So this package provides all of the tools that you need to plan, promote, and deliver this workshop to your organization or in your community. It's a 6-hour workshop in total. It can be delivered in person or online in either 1 or 2 sessions, and it's designed for groups of 10 to 25. It focuses on various forms of stigma with a specific focus on structural stigma, ways to advocate for change, and the importance of meaningful partnership with people with lived and living experience. So this workshop was created after we heard from participants in our knowledge exchange forums that structural stigma was a main barrier to implementing a public health approach. And it focuses on principles of stigma reduction, collaborating with people with lived experience, and approaching substance use through a health and human rights lens. So that concludes our presentation today. We want to thank you all so much for being here today for your engagement. We're happy to answer any questions now, and you can feel free to reach out to us at substanceuse@cpha.ca.
Thank you so much, Kelsey and Alexi. Great presentation, a lot of content in about 45 minutes. Don't see any questions from the audience right yet, but if you do have a question, you throw it into the Q&A module, or you know what, we're not a lot of people. If you want to raise your hand and we can open things up for you. I wanted to mention just some of the comments that came up as we were going through our approval process, and just to note that the framework, as Kelsey and Alexi have mentioned, doesn't include all of the levers that are available or all of the criteria that you need to consider if you were going to implement this. It is a high level framework still. and it really is supposed to be the starting point of a conversation, not the end point. So keep that in mind if you want to start using them. And certainly, when you look at from a governmental perspective, let's say, there are going to be legislative and regulatory levers that could be incorporated. We didn't get into that because that's not really wasn't the focus of this framework. But we recognize that that's a different way of looking at it. And finally, as Kelsey and Alexi mentioned, this is about all psychoactive substances. So if you were having a discussion about caffeine drinks, sugary, like sugar sweetened caffeine drinks, and their impact in your community, you could be using this framework. If you were talking about alcohol policy, tobacco, you name it, a lot of the language used is the language that is currently used around currently illegal substances, but in fact, it applies across the board. So just keep that in mind as you're moving forward. See, we do have a question from Nick. Have any audiences, stakeholders expressed interest in implementing the framework? What do next steps look like? I'll turn that over to Kelsey to answer.
Sounds good. So I would say that throughout the project, because this kind of concept of a public health approach has been discussed so much over, these 4 years, there definitely has been interest in uptake of a public health approach kind of generally, because the framework itself was only published within the last few months. Those examples that we shared are kind of the main stakeholders that we've heard from as far as kind of more tangible ways of implementing the framework at this point. As far as next steps go, we hope to kind of continue our project work in moving more into that implementation space. So now that within this project, we've been able to build some consensus, find a kind of clear definition, while we acknowledge that that may evolve. We have kind of a starting point that we can use now to do future work in developing tools, resources, continuing with substanceuse.ca to help focus a bit more on implementation within different areas of public health.
Excellent. Thanks so much, Kelsey. And I had this brilliant thought and it just escaped my mind. That's par for the course around here. So just remembered it. So please stay tuned. The next policy initiative that CPHA is working on is a comprehensive position statement on public health interventions to address the current toxic drug crisis in Canada. So we were planning on doing a position statement on safer supply and realized that when the paper that was published by Bonnie Henry's office in BC really covered the field on that. So what we are doing and what we've heard from the community is that because the issue of substance use and the toxic drug supply has become so politicized and polarized that politicians, contrary politicians, are picking off interventions one by one and putting out false arguments about them. And so the next position statement is going to lay out the entire continuum of public health interventions, from needle exchange to safer supply, to talk about how they all play a role and that how governments need to implement all of them as appropriate to their context in order to get ahead of the toxic drug supply. So look forward to more information on that in the coming months. I don't see any other questions, so we will wrap things up, but I will let you know that come back tomorrow or check out our website. We're having another Canadian Public Health Week webinar on CPHA's recent position statement on a public health approach to sex work. So go to cpha.ca/CPHW for more information on how to register for that. Thank you very much for joining us. Thank you again, Alexi and Kim. Have a great day and enjoy Canadian Public Health Week.